Welcome everyone. It's terrific to see so many people coming on board to our webinar for the final day of National Reconciliation Week. And as Windana, we warmly welcome you to this event. I'm Kent Burgess, and I have the very great privilege of being the newly commenced CEO here at Windana. And I'm very excited and pleased to be able to introduce the sharing of our program, our First Peoples Healing Program, and the amazing work that Janelle Houston and our team deliver. And I'm really pleased that we have Janelle with us and her team members as well. And we also have our amazing partners from DDACL, Dean McWhinney as Manager of Aboriginal Health Programs, joining us as well this afternoon. So let me commence by acknowledging that we are always on Aboriginal land as we live and work. Our services at Windana are across our Bunurong land and our Bunurong land, and also on the lands of the Wadawurrung, the Dja Dja Wurrung and the Wurundjeri people. And we pay our deep respects to Aboriginal elders past, present and emerging, and also acknowledge our Aboriginal staff members, our volunteers, our clients and community members, and the very great strength and value that they bring to the work that we do here at Windana. And it is a great privilege and responsibility as Windana that we, as a not-for-profit organisation working across the alcohol and drug sector and with our mental health and family violence and youth programs, we have a responsibility to advocate and focus and walk with our Aboriginal community on the journey towards truth, treaty and justice for First Nations people. And Windana proudly stands ready to proactively working with our Indigenous community. And this work is one great example of how we try to work towards health equity for First Nations Victorians through our program. So I know, like me, you're looking forward to hearing more about it. And so I'm going to hand over to Janelle. Janelle is a senior clinician and leads our Windana First Peoples Healing Program. She has over 15 years experience working in the alcohol and drug and mental health sectors and works out of our Frankston, Mornington Peninsula alcohol and drug services and works across with Windana to help build and grow our work with Aboriginal and Torres Strait Islander clients and community members, and to provide services that are culturally safe, meaningful, and appropriately support our Aboriginal clients and community in their journeys. Janelle is passionate about listening without judgment, about empowering our clients to take the lead in their own recovery journey. And so I'll hand over to you, Janelle.
Thank you, Kent. I'm just going to now share our slides. There we go. That's fantastic. So good afternoon, everyone. Thank you, Kent, for your introduction and acknowledgements. I'd like to start by saying that throughout our presentation, you'll see some beautiful artwork, and I'd like to acknowledge the artist Hunter Dillon and Shaden Bloomfield for them supporting us at Windana with their beautiful artwork throughout this presentation, and also that they've created the artwork for our Reconciliation Action Plan. It's a privilege to be here to speak with you about the First Peoples Healing Program. Windana is an organisation that supports individuals recovering from alcohol and drug dependency. Among its many programs, the First Peoples Healing Program stands out as an exceptional exemplar of cultural-led, trauma-informed, community-based care. Today, also, we'll be speaking Alison Jury, who is our Aboriginal Wellbeing Worker, and Barbara Wyatt, our Aboriginal Senior Wellbeing Worker. And I welcome Dean as well, who will speak later. So, why the First Peoples Healing Program was created? The First Peoples Healing Program at Windana was established in 2023. Its objective is to support individuals aged 16 to 55 who identify as being Aboriginal and Torres Strait Islander, and their immediate family around concerns related to alcohol and other drug misuse. This program was designed for First Peoples, and the distinction is critical. It provides a culturally grounded pathway to healing by integrating support for individuals and their families. Funded by the South Eastern Primary Health Network, also known as SEMFN, in a response to a lack of culturally safe and available services in the Frankston-Mornington Peninsula. The program supports the Aboriginal and Torres Strait Islander people by building an understanding of recovery and harm minimisation, facilitating individuals with group psychoeducation services, case management to support community linkages, and navigating mainstream services for better awareness and response for Aboriginal and Torres Strait Islander people and their families. Windana's First Peoples Healing Program aligns closely with several of the closing of the gap targets, particularly those related to social and emotional wellbeing, reduction of incarceration rates, and improving access to cultural appropriate health services. When we link also the VADA's submission to the Uric Justice Commission report, we find that we know what the data is, and we know that from lived experience that the culture is centred to healing, outcome improvements, healing becomes not only possible, but sustainable. This program does more than address the effects of substance use. It addresses the root causes, including intergenerational trauma, symptom racism, and forced disconnection from culture. It is a model in itself and the determination in action, and it shows us how to move forward if we truly aim to make a difference. So the overview of the program has been established to improve clients' experience of care, improving health outcomes, promote Windana as a culturally inclusive organisation for Aboriginal and Torres Strait Islander peoples, and provides easier access into AOD support in the community. The key focuses are through culture, connection to local gathering places, Aboriginal healing practices and group work, trauma-informed treatment, counselling standard and complex, protective factors and support, and including individual treatment plans. Clients who do not live within the FMP can access secondary consultation through one of our clinicians. This secondary consultation will give details of their Windana services that may be in their catchment, support with other linkages, support with cultural practices, support with completing intake screenings. Workers in unique circumstances can still work with clients outside the area if they're wanting detox and rehab through Windana and open to phone appointments. Windana's model of care is an overarching framework that brings together the values, approaches, principles, commitments, and initiatives that guide us how we deliver our connective services. Our model of care and our First Peoples program gives the importance of cultural safe and responsive care for First People, respects the cultural values, addresses physical, mental, emotional, and spiritual wellbeing, and the importance of establishing trust between healthcare providers and First Peoples. Understanding how factors like housing, education, employment affect health. I'd like to introduce our new Healing Journal resource. This individual journal that the clients can have as part of their recovery is coming soon to Windana. It'll include a wellness plan, people who are part of the client's life, relapse prevention and strategies, contact numbers, and individual treatment plans. Windana's First Healing Program is a powerful example of how we can how this can be done with care, integrity and respect. It reminds us that culture is not a barrier to recovery, it's a foundation of it. Thank you for my part. I've been very nervous today. So thank you for your time and attention today. I encourage us all as professionals, advocates and community members to continue supporting programs like the First Peoples program, your voices, and uphold cultural strength as the key long-term wellbeing. I'd like to introduce Barb White, who's going to speak about the work that we do. Thank you.
Hi everyone, and thank you for attending. I've worked with a lot of your services. So to identify the journey for our program, our referral, we have our own referral form, which most of you will be aware of, and they are normally sent through our First Peoples Windana email, or you can contact Janelle on the number that's on the screen. We do assessment tools once working with the individual, and we gather this information, and it includes a K5, and also one of our assessment tools is a culturally safe assessment tool, so trying to make it less difficult for individuals. We do individual treatment plans to establish what goals are for individuals, and also support them around outreach and group work, and there's the option of standard complex counselling and care recovery for up to 15 hours, and we review this at the end of that to see if there's more needed in that. So client's journey is reviewed regular because things can change and circumstances can change, as you can be aware. Closing the group work, clients will have the option to attend groups with Windana or with our own personal program, or also we look at linking into the community for what's available in there as well. Connecting with our program, the eligible ages can say 16 plus, but I have had 14 and 15 up. They do not need to prove their Aboriginality because this can be difficult at times, but if we're able, we'll support them in trying to do that journey. We can have a family member who identifies, so it could be that it's their children, it's their partner as well. And we cover the Frankston, Mornington Peninsula catchment. Sometimes it's they might go out of the area or they come into area as well. And accessibility and outreach, availability, GP appointments, court support, attending gathering places, appointments related to ITP, culturally safe area, it could be the home, the beach, the park. We can complete these assessments if appropriate without any risk. So we understand sometimes we've got to go to the individual. Thank you.
Hi everyone, my name's Alison. I'm a proud Bunurong woman. I've been in the First Peoples Healing Program since February this year. This work deeply aligns with my own personal cultural journey, and I feel really privileged to be able to walk alongside our community and in a space that supports healing, strength and connection. As you can see, we've got several cross-referral pathways, including strong partnerships with VACA's family, justice and youth programs. We also work closely with First Peoples Health and Wellbeing for clinical and psychological support. Peninsula Health is our local intake service. In this area, when clients identify during their intake, they're referred to us. We often refer back to their programs as needed. As you can see, we also work with the local sheriff. Centrelink is another one that I don't think is on there. Legal services. DDACL have just set up a community of practice that we'll talk about soon. I also attend the local gathering places on a regular basis, and they've got many programs to support our clients with their cultural connection as well. Importantly, I think if a client requires a service that we don't currently engage with, we'll source it so that we can make sure that their needs are met as well. So I will now hand over the presentation to Dean from DDACL. Thank you.
Thank you, Alison. Thank you, Janelle and Kent, for having me join the team today and present a little bit about what DDACL does. And I'll start by saying I've done a little bit of public speaking before, and usually there's a number of people in front of me. It's a surreal experience staring at a screen and not being able to see anyone at all. But enough of that, let's get on with it. So the topics I'm going to cover today are who are DDACL, programs we offer, working with Windana, and the newly established community of practice. So DDACL is an ACCHO, or Aboriginal Community Controlled Health Organisation. This means that our board of directors are First Nations people, and our CEO must also be a First Nations person. We are one of the oldest co-ops or ACCHOs in Victoria, established in 1975, and celebrate our 50 years just around the corner in July this year. We offer holistic and culturally appropriate programs that adapt to the changing needs of our local Aboriginal people. And I'll just say also that there's a bit of information in these slides. I'll try and cover most of it, but the slides will be sent out for you to refer to later. So at DDACL, we have Bunurong Health Service, Social Community Services, Aged Care and Disability, and Aboriginal Health Programs. Our health service is our GP clinic. So that is 5 days, Monday to Friday, from 9 a.m. to 5 p.m. Apart from our GPs who are there all the time, we also have a number of visiting services. So a psychiatrist, we've just recruited a psychologist as well. Paediatrician, and forgive the spelling on that, the incorrect spelling of paediatrician, endocrinologist, diabetes nurse coordinator, optometrist, Hearing Australia, and Monash Health Dental also have a day where Aboriginal and Torres Strait Islanders can go to their service, and we will make those bookings and take the patients there. As for our social and community services, we have the Integrated Family Services team, and they work with families experiencing multiple and complex issues to keep Aboriginal identified children safe. The team's focus is to strengthen parenting competencies, enhance wellbeing, and ensure the best interest principles to support child-focused outcomes. Then there's the Aboriginal unit of Orange Door as well. As far as our aged care and disability, we have the Commonwealth Home Support Program, which is for Aboriginal and Torres Strait Islanders over 50. And we have the Home and Community Care Program for younger people. That is for people under 50 if their capacity for independent living is at risk. Those programs, and we also have the NDIS, which is home care packages for people with more complex care, that their needs go beyond what the first program can provide. Within that, there is the domestic assistance, personal care, social support for individuals, garden maintenance, and social support in the group form. Aboriginal health programs. Now, this is what I know the most about because these are my teams. We have the Social and Emotional Wellbeing, or SOOD team, First Nations Cancer Screening team, Tackling Indigenous Smoking, Koori Maternity Services, and Integrated Teen Care. Before I speak more about our particular teams I just mentioned, I'll chat a little bit about the collaboration between First Peoples and DDACL SOOD team. So there's the client support, and one of the ways that we work together to support clients when the First Peoples team identifies someone who has dual diagnosis concerns, they'll refer them to us, as we have a mental health worker and an AOD worker. We have the shared group activities, and two examples of those last year. We held a cultural day. We had someone come in and teach bush medicine and spear throwing, and so the First Peoples team came along to that. And then they held a fishing day at the end of the year, and we came along and enjoyed that activity as well. One of the things about working closely together is that there are the warm and timely referrals, emails, phone calls to make those referrals, and we can drop clients off, bring them along. Hot desking. So the First Peoples team has put that to us that if we're in Frankston, we can always drop them and work from here. And now that we have a new office in Cranbourne, we've shared that same thing with them. And the brokerage support. So we have brokerage money for any First Nations person who is seeking AOD treatment, and that money can be used as long as they're engaging for treatment. Things like travel needs. An example of one of the stories that I really love was Barb sent through a referral for a gentleman who had seriously injured, broken his back from a horse riding incident, couldn't work, had become addicted to pain medication, and needed a decent amount of money to have an operation, to have an electrical insert in that would take the pain away. We were able to establish a link between his sobriety and recovery to this need and paid for that. And I remember the day that he called up, and my AOD worker at the time had been having one of those weeks that we can have at times and wondering why she was doing the work. And he rang up and said, "Thank you so much. You've changed my life." Really heartwarming moment. So the food team, social and emotional wellbeing, works with community members, their families in a holistic approach. It's not just about AOD or mental health. It's about the physical, mental, emotional, social, cultural, and spiritual health. I think one of the things that struck me when I first started working at DDACL and understanding food was that our First Nations people have been here for tens of thousands of years. Obviously, they know what works. And this is what the evidence and the research shows works. Connecting to mind and body, family and kinship, community, culture, country, spirituality, and ancestors. We offer a range of services, including drug and alcohol support. So CRC is going out to clients, referring them to rehab, detox, doing home visits, some counselling, referring to mental health support as well. Our mental health support provides services that focus on trauma, grief and loss support, referrals to other allied health services, outreach support to appointments and home visits. And our SUB support, and this is about the connection to culture, social support, connecting to mob, country and community. Part of their role is to facilitate cultural groups and events and also do outreach. The team is about to begin, and flyers are at the end of this presentation as well, the weekly wellbeing group every Monday. The groups are to provide a safe and supportive space for the clients to address their challenges through culturally relevant practices and peer support. Some of the groups will involve discussion around mental health, AOD, SUB, resilience, cultural identity, and community connection. In August, they'll be starting the Cultural Arts program with Living Culture. The program consists of a space for community to express themselves through art and engage in cultural healing in a unique and personal way. And the School Holiday program. This has been running and will continue to run with Headspace Frankston and is designed to foster a sense of community amongst the youth participants and engage them in a mix of cultural, outdoor and fun activities for the school holiday period. As an example, the last school holiday period, one of the activities was going to come by our world. Now, all these programs that I'm sharing receive referrals from external services. So if you have clients that you know are looking for any of these things, please do refer them through. The community of practice, as mentioned by Alison before, is in partnership with the Casey Gathering Place and Monash Health. The purpose of the community of practice is to support and build capacity of individuals working with Aboriginal and Torres Strait Islander people to improve health outcomes, as well as enhancing the cultural capability of individuals and organisations. They're held bi-monthly and rotate between having organisations come and speak and doing reflective practice as well. This is some of the information I've spoken about. So the community of practice, the weekly wellbeing group, and the cultural article. Thank you. Now there'll be time for questions, I believe.
I just want to show them a video. If I
Yes, and I'll hand back to Janelle.
Thanks, Dean. So Barb had do you want to come over, Barb? So Barb's been able to interview one of her clients, and we're lucky enough to be able to share the recording with you guys today. So just bear with me and I'm going to push play. Thank you.
I first come to know Barb Task Force, or Windana, commonly known now as, I was employed at this time, working at a residential rehab for juniors, anywhere from 14 to 22, and yeah, soon enough it just, you know, snowballed and I took on too much too soon. So yeah, things come to a head. Well, with my history in a lot of things, commonly being drugs, I knew of a lot of services that I had never tried before. So I just asked a question and asked for help. And that's where I met and was introduced to Barb from Windana. She has been a great support, great mentor, and yeah, she's helping me fight the struggle, kick the habit, and get back out there and kick goals again. It was a non-judgmental community, gathering place, somewhere you could speak and not be judged. I was made aware of the cultural significant non-judgmental attitudes towards myself and others. I was welcomed inside the collaborative aspects and theoretical work boundaries that they shared with their clients. Well, I was supported and completely uplifted to set my own goals and boundaries whilst I was working within the community. Well, I'd love to finish the diploma. I've only got 3 modules to go, and getting back into the AAD outreach youth work, overall helping others in general to become a recognised Aboriginal AAD worker with an empathetic attitude, known within the community and very approachable. I can't say I'm not approachable because I love to chit chat myself. So, yeah, bring it on. Just ask a question. If you need help, just pick up the phone. It's a tip-top program. Like I can't fault it whatsoever.
Amazing. Thanks, Bob, for doing that interview. So we're going to go to some question time now. So I'm going to check the chat box and see if anything's come up. We've got a couple of questions there. So one of the questions is, where do we see the program going in the future? Where do you think it's going, Bob?
I'd like to say it's got movement to grow bigger and to reach out to other areas in it. Like other referrals, people who have seen incarceration coming out in that, so to maybe go to the individual clients before they come out into the community, so they've got support right from the beginning. That also there's other areas like corrections and all that where that could make it a bit more easier pathway for individuals and that. So and to spread, because we do have a lot of clients here out of areas, and we just support them to try and be supportive, so that they're not just left to follow on the side of the road.
Thanks, Bob. How long do we work with the clients for? So that depends on the individual of the client. So we do 15 hours of the care and recovery with the clients, so the case management, that can then be extended. I want to make it clear that we offer groups as well. So we offer groups within Windana, we offer groups as well as the program. So on exit of the client, even though that they won't have a one-on-one worker, they'll still be eligible to attend groups. So they're connected through Windana even after they've stopped the one-on-one support. Next question. Do we work with families? Definitely we work with families. As mentioned before, that you do not need to identify with for being Aboriginal. You can have children or family members who identify as Aboriginal, and we will then work with you with a cultural lens, and we'll obviously be able to work with you to educate you on different programs and how to be able to be more cultural sensitive to your loved ones.
And coming from a family background, service before this, I know working with one, if you're working with whoever they identify as family, it's just recovery for all, and you get better outcomes.
Next question is, what does secondary consultation look like? So secondary consultation would be that if you are unsure of services or you're unsure on how to work with someone that identifies as Aboriginal or Torres Strait Islander, we have vast experience in this field. Barb's been in the industry for 30 years. I've been around for 15 years, and Alison is an identified worker. So with the three of us, I'm sure that we can come up with a suggestion that any of you are needing, and especially with Windana as a whole. So Windana is very big, and we've got lots of rehabs, and we've got a detox for youth and for adult. And if you're needing to navigate those services, we're always open for a conversation. Just waiting to see if there's any more questions that come through. Looks like that's it. Okay, well, we're finished up a little bit earlier than expected. So thank you everyone for listening today. And you want to share, Dean wants to share some more. That's great.
I was sitting there reflecting on what I'd said and I'd misread my slides and realised that I said I was going to speak about the health programs more later and didn't. So I might just take a moment to do that now. Our First Nations cancer screening team are a health promotion team. So their role is to create awareness around breast, cervical and bowel cancer and hold groups to create awareness around it. They have a driver, you drive women to breast or cervical cancer screening appointments. Our integrated team care is a team that works with people who have long-term illnesses. So they provide care coordination and supplementary services. The care coordination is to ensure they understand their GP appointments, what the doctor has prescribed or said to them. And the supplementary services is brokerage to support them with medical aids, things like walking frames, CPAP machines, that sort of thing. Our Tackling Indigenous Smoking team is about smoking and more so vaping education. Most of it is done in schools with teenagers, but also to adults in other groups as well. Our Kuru Maternity Services is a team that works with women pre and postnatal up to 18 months old and the babies, I believe, and they run groups for women and also provide education. That is all. Like I said, I spoke about the Sue team before, and now I feel good I've made keeping good on my promise to speak about those teams. Thank you. What's next, Janelle?
I'm just going to go to the next slide. Last slide. So this is the contact details for referral for the program. So that's at firstpeoples@windana.org.au, or you can call the number below on 9532 0811, or simply just calling myself on the number that's there. So thank you all for attending today. I appreciate all the staff at Windana for putting the slides together, being my mentors, supporting us all to get through this webinar today. Thank you.